Now, the last of the medically relevant cocci is the Neisseria meningitidis or the meningococcus. So the one of the most important virulent factors of meningococcus is the capsule. Okay, we're going to see that the capsule has this huge importance when it comes to this infection. So kind of keep that in the back of your head for a moment. Other virulence factors are the Fimbriae, Ig protease, and the endotoxins. So if you guys remember, endotoxins was the lipopolysaccharide that was found in gram-negative bacteria. So here is we're going to take a look at what those endotoxins do. Now, meningococcus tends to be pretty common among college students, especially living in dorms. The spread of infection occurs due to droplets, so sneezing, coughing, sharing chapstick, sharing drinks. Okay, all of that very close contact with each other that can kind of help with the spread of the infection. So the epidemiology here is, again, meningococcus tends to be found in the nasopharynx of about 10% of us, and without causing the disease. But it can eventually get into the bloodstream and get into the meninges, leading to meningitis. And again, the highest risk individuals are those who live in close quarters, like, for example, very young kids, young adults, again, college students. When the bacteria enters the bloodstream, it can cross the blood-brain barrier, getting into the meninges, and it starts to grow inside of the CSF. Okay, the symptoms happen very fast, okay, and a lot of the symptoms are neurological, which makes sense. And here you can see some of the transmission, so the routes, kind of like how it gets from the nasopharynx, where it usually resides, again, in 10% of us, in 10% of the population. And then from there, it kind of goes from the nasopharynx crosses the blood-brain barrier and gets into the CSF, and that's where, how the meningitis infection would start. Okay, so the epidemiology and the pathogenesis of meningitis is that it's really because of those endotoxins. Okay, so those endotoxins will get into the bloodstream, and we call that meningococcemia. Okay, and as you can see here, it causes a kind of like a wide range of different signs and symptoms. So you can see here the hemorrhage that happens all over the skin and the mucous membranes. We call this petechiae, and that these tend to develop on the trunk, on the mucous membranes, on the upper and the lower limbs. It also comes with other signs and symptoms. Okay, so for example, the patient could come in with a sign called photophobia. Photophobia means that the person becomes afraid of light. It's not that they're really afraid of light, it's just that the light hurts their eyes. Another sign would be a rigid neck, so their neck muscles would be stiff. And these are, signs that kind of indicate the possibility of meningitis. So what we would do is we would take a sample of the CSF, okay, and look at it under a microscope. We're going to look for those gram-negative diplococci, and then we will do a rapid test for the capsular polysaccharide. So remember the capsule that I told you to remember, because we could test it. So there are rapid diagnostic tests for the capsule. Okay, so how do we treat? Well, we treat with penicillin, cephalosporin. Those are your treatment options. You also want to treat anybody who was in close contact with that person, even if they're not showing any signs and symptoms. That is called prophylactic treatment, to kind of be proactive, just in case they were exposed. There is a vaccine against meningococcal meningitis, and again, the vaccine targets the capsule. So to make sure we're all good here, a common cause of meningitis in young adults is found within which genus? Is it strep, staph, Neisseria, or Moraxella? that would obviously be the Neisseria. So make sure you email me if you have any questions, and that concludes this chapter.